How common are complications after mastopexy? When considering a breast lift or mastopexy, it's natural to wonder about the risks involved. While most patients have smooth recoveries, complications can happen, but their frequency and severity vary based on individual factors and surgical details. Mastopexy is generally regarded as a low to moderate risk procedure, but like all surgeries, it carries some potential issues. Infection and bleeding are common concerns with any surgery. Postoperative bleeding or hematomas, which are collections of blood outside the blood vessels, can occur but are usually manageable with prompt medical attention. Scarring is another inevitable aspect of mastopexy since scars are permanent. Over time, scars tend to fade and become less noticeable, often within 1 to 2 years. However, some patients may experience hypertrophic or raised scars, which can be more visible. Changes in nipple or breast sensation are also common in the short term. Many patients notice temporary numbness or tingling that typically improves within weeks. Permanent loss of sensation is less common but can happen if blood supply to the nipple is compromised during surgery. Asymmetry or contour irregularities may develop, especially if healing is uneven or if pre-existing asymmetry was present. These issues sometimes lead to the need for revision surgeries to improve the shape or symmetry. Fluid buildup, known as seroma, can occur after surgery and might requiring drainage. Delayed wound healing is another possible complication, especially in patients with certain risk factors. When mastopexy is combined with breast augmentation, additional risks include implant malposition, wrinkling, rupture, and capsular contracture, which is the hardening of scar tissue around the implant. Studies show that implant malposition can happen in up to about 60% of cases, especially in patients with significant weight loss, and revision rates for implant-related issues range from around 6% to 25%. Rare but serious complications include partial or total loss of the nipple or areola, which can happen if blood flow is severely affected during surgery. Fat necrosis, or death of fatty tissue within the breast, is uncommon but possible. Overall, minor issues like swelling, bruising, and temporary discomfort are very common and usually resolve on their own. Major complications requiring further surgery are less frequent but do occur in a minority of cases. Patients with certain factors such as smoking, significant weight loss, or poor skin quality may face higher risks. Choosing an experienced plastic surgeon and following postoperative instructions carefully can help reduce these risks and ensure proper management if complications arise. In summary, while complications after mastopexy are not rare, most are manageable and serious adverse events are uncommon. It's important for patients to have realistic expectations, understand the potential for some scarring, sensation changes, or asymmetry, and know that sometimes revision surgery is needed to achieve the best results. Always consult with a qualified healthcare professional to discuss your individual risks and concerns before proceeding.